Heart attacks, also known as myocardial infarctions, are a leading cause of death worldwide. As researchers continue to explore potential strategies for preventing cardiovascular diseases, a recent topic of interest has been the role of vitamin D supplementation. Vitamin D, often referred to as the sunshine vitamin, is known for its crucial role in maintaining bone health. However, emerging evidence suggests that vitamin D supplementation may have a protective effect against heart attacks. In this video, we will explore the findings of these studies and discuss the role of vitamin D in cardiovascular health. Vitamin D is synthesized by the skin in response to sunlight exposure and can also be obtained from certain foods and supplements. It plays a vital role in maintaining calcium and phosphorus levels, promoting bone health, and supporting immune function. However, studies have indicated that vitamin D deficiency may be associated with an increased risk of cardiovascular diseases, including heart attacks. Several observational studies have investigated the relationship between vitamin D levels and the risk of heart attacks. These studies have consistently shown that individuals with lower levels of vitamin D are more likely to experience cardiovascular events, including heart attacks. Additionally, some randomized controlled trials have explored the effects of vitamin D supplementation on heart health. One notable study published in the New England Journal of Medicine examined the impact of monthly high-dose vitamin D supplementation on cardiovascular outcomes. The study involved over 25,000 participants and found that those receiving vitamin D supplements had a significantly lower risk of heart attacks compared to the placebo group. However, it is important to note that more research is needed to confirm these findings and determine the optimal dosage and duration of vitamin D supplementation for heart health benefits. Mechanisms behind the potential benefits. The mechanisms by which vitamin D may reduce the risk of heart attacks are still being investigated. Vitamin D is known to have anti-inflammatory effects and may help regulate blood pressure and improve insulin sensitivity, all of which are important factors in cardiovascular health. Furthermore, it may play a role in reducing the formation of plaque in the arteries and prevent blood clot formation. Consultation with healthcare professionals. Before starting any new supplementation regimen, it is crucial to consult with healthcare professionals, such as doctors or registered dietitians, who can assess your individual needs and provide personalized recommendations. They can evaluate your vitamin D levels through blood tests and guide you on the appropriate dosage and frequency of supplementation based on your specific health status and risk factors. While research into the potential benefits of monthly vitamin D supplementation in preventing heart attacks is promising, more studies are required to establish a definitive link and determine the optimal dosage and duration of supplementation. In the meantime, maintaining a balanced diet, getting regular sun exposure, and following a heart-healthy lifestyle remain key factors in reducing the risk of cardiovascular diseases. As always, consult with healthcare professionals for personalized advice on vitamin D supplementation and other preventative measures to promote heart health.